Yeah, Steve Marcroft. I'm a canola pathologist based in Horsham in Victoria. Yeah, disease pressure in different regions is a good question. So the disease that we see across Australia really varies between different canola regions, and the reason for that is really based on annual rainfall and the intensity of canola production in a region. So canola or blackleg survives on canola stubble, so the more canola stubble there is from previous crops in the region, the more blackleg inoculum there will be, and being a fungal pathogen, it needs moisture. So the higher rainfall, so the combination of rainfall and canola intensity is really what drives the disease. So optimal fungicide regimes are really going to depend on the growing season, on the cultivars the farmers are growing, and the region that they're in. So for instance, if you're in a canola, wheat canola type rotation, a high rainfall zone, you'll in most years get a large benefit from fungicide, whereas if you're in a lower canola intensity area with a 1 in 4 year rotation and slightly lower rainfall, it might be that the genetic resistance of the cultivars you're using is sufficient. So it's really a horses for courses type thing. You really need to understand what the disease is, and you do that by knowing, assessing your crops in previous years, getting a handle on how much disease you've got, and then you can introduce a fungicide regime if it's required. So in answering that, if you're in that high rainfall zone, high canola intensity, obviously your seed will come with a seed treatment which will give you some seedling protection, and then in the winter period at that 4 to 8 leaf stage, you'll know how the season's progressing, how much rainfall there's been, and you can go out and assess your crops and see how many leaf lesions there are, and then you can make that informed decision, do you put a foliar fungicide on? And then later in the growing season, when the crops start to flower, again you can get out, look for more leaf lesions, look for flower infection, and look at the timing of the year. Is the crop starting to flower in that winter period in late July? It means it's a high risk for upper canopy. Is it flowering in mid-August, a moderate risk, or late August, which is a low risk? So you bring all those factors together, and then you can make that decision on whether fungicides are required or not. So one of the critical things with deciding whether to put a fungicide on is the genetic resistance of the cultivars. So every year we screen all the commercial cultivars and all the pre-release cultivars for blackleg resistance. It's a GRDC funded project across all the different states. We have 8 different disease nurseries across Australia, and all the cultivars are then classified on their blackleg rating, and you can download the blackleg ratings from the GRDC website, the Blackleg Management Guide. And that's really the first place to start with your fungicides. For instance, if you're putting a fungicide on a highly rated, an R-rated canola cultivar, the chances of getting a yield response from a fungicide is a lot less than if you're putting on an MS, for instance. But that also depends on the environment you're growing it in. So an MS in a mallee type environment still probably won't get any blackleg, whereas an MS in a high rainfall zone will get an enormous amount of disease and really benefit from that. So the blackleg ratings are really critical, first place to start. And the other thing with the blackleg ratings is blackleg being a sexually reproducing pathogen, it overcomes the resistance in our cultivars regularly. So which is why we screen all cultivars every year. So if that resistance is being overcome, it will get a new blackleg rating. So it's really critical to get this year's blackleg rating, so you know what the status is this year. And it's also critical to get out and cut crowns on your own farm so that you know how that cultivar is performing on your own farm, because they can be localised populations. So it's really, really important to get out at the end of the year and each year and just know what the status is of your own cultivars. So the best way to check for disease, and this is in the Blackleg Management Guide if you want to download that from the GRDC website, but the best time is at the end of the year at windrowing stage, pretty much straight after you've windrowed. You can walk through the stubble, pull the stalks out of the ground, get a pair of secateurs and just cut the roots off, and you'll see the black discoloration in the crown if it's there. And the canola plants can tolerate some disease, so if you're getting 10-20% discoloration, you won't get a lot of yield loss. Between that 30 to 50% discoloration of the crown, that's when the yield loss starts to occur, and once you get past 50%, that's when you start getting that real yield loss. So if you're getting plants in that 30% plus discoloration, I would suggest that's when you want to be changing your practices to try and reduce that level of disease. If you're below that, you can continue your current practices. Traditionally, we've had the DMI type fungicides, the Jockey, the fluquinquinazole and the Impact, which we put on the fertiliser. And in more recent times, we've got the STHIs and the strobilurins. And I guess if you look at it, the DMIs have done a wonderful job. The other one I should have mentioned was the Prosaro as a foliar DMI. So they've done a wonderful job, but the STHIs, there's no doubt the STHIs are a step above that type of fungicide. But we've been screening since 2015 populations of blackleg. So in conjunction with Angela van der Wel and the University of Melbourne, we've screened about 300 populations, And what we've seen is that in about 30% of paddocks that we test, we find some resistance to the DMIs. At this stage, we haven't found any resistance at all to the SDHIs or the strobilurins, but because they're new, that's not surprising, but we do have the resistance to the DMIs. The interesting thing, I guess, with that resistance to DMIs is although it's very easy to identify, we don't really know yet what frequency it's at and whether it's causing like failure in the field or not. So that's, I guess, the work that Melbourne Uni's undertaking at the moment, is to start looking at those frequencies and to see if those frequencies within populations is actually increasing. But it's a real warning sign, I guess, that the more we use these fungicides, that we are going to have resistance issues. And I think the other thing we need to state there is with the SDHIs and the strobilurins, we know from internationally that when they get overcome, they are more dramatically overcome. So they're either effective or they're not. Whereas with the DMIs, you see this gradual reduction in efficacy. So it's something we need to be on the lookout for. I guess the pressure to overcome the efficacy of the fungicide is really about how often you use those fungicides. So if you're using, for instance, a seed treatment, then an earlier foliar, and then a late flowering type application, or a couple of them, all with the same chemistry, that's what's going to put selection pressure on the pathogen and overcome that. So it's really about, the first thing I think is deciding, do I need a fungicide or not? Is this a season where blackleg is going to be really severe and I'm going to benefit from fungicide? If it's not, I don't need to use it. If it is, I'm going to use it, and there's really good reasons for doing that. So that's the first thing. What is the genetic resistance? Can I get away with good genetic resistance and just a seed treatment? Do I need to come back with that foliar, etc.? So it's getting a handle on how much actually fungicide you need and not overusing fungicides. And then really the rule of thumb is to put one application on for any one part of the disease. So if you're trying to control crown canker, which means, and to control crown canker, that's the applications for the seedling protection. So that's the seed treatment and then the earlier foliar between the 4 to 8 leaf stage. So if you're going to put 2 applications at that stage, make sure they're different modes of action. Don't put 2 DMIs on or 2 SDHIs on at that stage. So don't use a SDHI seed treatment and then come back with a SDHI early foliar. However, we also see that the upper canopy blackleg infection, which is occurring on the flowers, is a completely separate infection event. So it's okay to use an SDHI, for instance, at the 4 to 8 leaf stage, and then another SDHI at the flowering stage, because we think they're completely separate infections and they're not putting any selection pressure onto the pathogen. So the rule of thumb is don't use more than one application of a mode of action for both crown canker and upper canopy. So if you're spraying on the flowers, only use one application of one mode of action. So if you're going to put 2 applications on, 20% bloom and a 50% bloom, make sure that's 2 different modes of action. And the same at the crown canker, if you're going to do a seed treatment and an earlier foliar, make sure that's 2 different modes of action. Don't use 2 of the same mode of action.